Hi, this is Dr. Rodger Murphree, your FibroDoctor.com, author of Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome. In today's fibromyalgia health tip, I'd like to share some information with you that I hope you'll find helpful in your quest to feel good again. Many of my patients suffer with a condition called Restless Leg Syndrome. You might suffer with that yourself. This is a condition that's associated with leg pain or leg fidgets, an uncomfortable feeling that you get in your legs usually during the middle of the night. Now, it can occur in other parts of the body, but predominantly we see that it's associated with in the lower limbs or lower extremities. And many patients will be prescribed medications that may be helpful short term, but can cause some damage long term. And so I'd like to give you some natural remedies that I use with my patients. Number one thing to do to help with restless leg syndrome is to get a good night's sleep. Now, I know that's a real simple advice because all of you struggle with sleep on a nightly basis, but that really is one of the most important things you can do is to get a good night's sleep night after night, going into delta wave sleep. A good night's sleep will reduce many of the symptoms associated with fibromyalgia, including restless leg syndrome. And so I encourage you to learn more about that in my book, Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, where I go into much more detail about that. One thing that you could try that's very helpful for my patients is taking magnesium at bedtime. Magnesium is a natural muscle relaxer, helps to relax the muscles, and also helps to relax you. And by taking magnesium, oftentimes patients will see that they will greatly improve the restless leg syndrome that they're getting in the night. Now, I recommend that you use a buffered form of magnesium, a magnesium chelate or magnesium citrate, which is easier on the stomach and you absorb it much more efficiently. I would start with somewhere around 150 to 200 milligrams at night, and then you could increase up to 300, maybe even 400 milligrams. Now, if you get a loose bowel movement, then reduce your dose of magnesium. Magnesium is a natural muscle relaxer, but it also relaxes the colon. Another thing I would encourage you to do is to make sure that your ferritin level, which is a sign of your iron stores, are above 50. Now, a lot of doctors don't test for ferritin. They'll do a CBC, they'll check your hematocrit, maybe they'll check your hemoglobin, but they won't check your ferritin level. And we find that individuals that have a tendency towards anemia, maybe even borderline anemia, are going to have problems with restless leg syndrome. So I would encourage you to make sure you don't have any issues with low iron. So have your doctor check your ferritin level. Now, you can learn more about restless leg syndrome and the protocols I use for my patients in fibromyalgia. You can learn about poor sleep and all sorts of things that I think you'll find very helpful in your quest to feel good again. This is Dr. Rodger Murphree, and my book is Treating and Beating Fibromyalgia and Chronic Fatigue Syndrome, where you can find all this information.